China. I mean, do you think that zero COVID as a policy, as it has been pursued, is frankly sustainable to achieve its objectives?
Well, I don't think it's sustainable. And I also think the images you showed were actually inhumane. I mean, it's not just totalitarian. That's really inhumane treatment of both people and actually animals, unfortunately, because there are also animal killings that are happening in China. So it is not a sustainable strategy for a virus that cannot be eradicated because of its properties.
And why do you think China is pursuing this policy? Many other countries, such as Australia and others, have effectively abandoned it, particularly after many of the more virulent variants emerged, basically vindicating those that criticise it, saying that it just wasn't possible to continue. Why do you think China has continued to pursue this policy?
I think one problem in China is that what the purpose of any mitigation, and obviously what you just showed is extreme, but purpose of any mitigation was to really try to get to the vaccines, the time of the vaccines, because then people who are older, especially, should get the vaccines right away and also get boosted. And one problem in China is that the Sinovac and the Sinopharm vaccines that they have are not the most powerful vaccines. In fact, the WHO ranks them among the least powerful vaccines of the 8 approved by the WHO. So they're in a terrible situation where the vaccines, they have not actually vaccinated their elderly populations to the degree that they need to keep the elderly safe. And they're pursuing this lockdown strategy that you're showing that's very hard to watch, actually. In lieu of that, what they need is to give people multiple doses, 3 doses of those vaccines, maybe even get the mRNA vaccines, and vaccinate and protect their vulnerable and elderly now. But they cannot do this to the whole population.
Defenders of zero COVID will say that comparatively it does lead to a lower death rates than some of the very significant death rates that we have seen in other countries. I mean, would you agree with that in terms of the balance of risks and the balance of consequences, that actually the lower death rate essentially balances it out in terms of some of the economic and the civil liberties challenges that are also faced?
The problem is what you say is true if you just look at COVID-specific deaths alone, but it is not true of overall deaths. For example, there was a Lancet article that looked at the overall deaths from the COVID pandemic, and those 6.15 million people have died directly from COVID. There have been a number, up to 12 million deaths, that are actually a result of everything else that went along. Restricting medical care, not taking care of cancer, HIV, tuberculosis, malaria, other infections, other public health needs. So everything that we do in public health has to be a balance about everything else that's going on.